Afternoon and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. I'm back in my spot as kind of the man in the middle, I guess. Spend a lot of time like this doing this, talking with various people that we have here in the studio. This week we have our doctors, Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health, Dr. David Jetmore, Wayne County Health Officer. I keep wanting to put in that public health officer. Wayne County Health Officer. Gentlemen, once again, thank you very much for being here. Appreciate the time.
Enjoy it every Friday. I know it's the weekend's coming when we're here with you, Eric.
Yeah.
On Friday afternoon.
I start my countdown when this show starts too, trust me. This week it's lawn work, so I'm sure my neighbors will be happy about that. Want to start like we do every week, just kind of things change from week to week, get a feel for what you all are seeing, what you all are hearing. So Dr. Huth, want to start with you this week?
I think what I've noticed is that the conversation of the week is all around education and how can that get started again, and I understand the frustrations associated with that. But from a scientific medical standpoint, we have noticed that there are some changes in the way that the people are looking at the treatments for COVID. There were, hydroxychloroquine's been on kind of a cycle or a pendulum, let's say. It's been in and out of favor. It's maybe coming a little bit back into favor. But we're hopeful that there'll be other new breakthroughs and other treatments coming forward, and I'm very curious about one having to do with antibody treatments that we can talk about more later if you'd like. Mm-hmm. But in terms of Reed's experience with COVID, we're continue to do well. I brought the graph today. We can go over that one. It's convenient. And maybe seeing a little uptick in a few days, but now it's settling down again. So we feel pretty comfortable about where we're at.
Nationally, we're hearing about some hot spots around the country, and even to a certain extent where some places in those hot spots are already seeing a wear down of their PPE equipment. Talk about for a minute what Reed's experience with that is. Not saying there is going to be a surge, but if there is, what kind of stockpile would you all like to have on hand beyond what you would normally do? And the normal days, as it were, are probably gone. And are you at that point?
We have not talked about PPE in a while. It hasn't been too much of an issue, but of course that's something that we follow and track very closely and make little adjustments in our internal PPE standards and guidelines over time, both with PPE and with testing capabilities of the different tests. But I think we, once we got over the initial hump, we sort of feel pretty good about where we're at with PPE. There are some items that we have lots and lots of stock on, but they won't last forever if we can't get access to replenishments. And then there are some things that are in shorter supply. And the problems are little minor internal things, like there are different types of N95s, and maybe some of the more commonly used types have at times run low, so we've had to make substitutions, things like that. Right now we're good, but I think if we get a surge, if either COVID comes back because for whatever reason, maybe it will just because of the seasonality, maybe there's a seasonality aspect. We don't know that yet, but that's always a possibility. Or maybe in combination with influenza, there will be heightened need for isolation procedures and PPE. So we are leaning into being ready for that. We feel like we've got a little window of time to do that, and we're looking to acquire basically as much as we possibly can to be prepared for the fall should there be another resurgence. Some of the hospitals in the Indianapolis area we're aware of have had ongoing challenges with PPE and have had a very difficult time. We've never been in that position, and so we're trying to lean forward into it to make sure that we don't get into that position. But it all depends on the suppliers making things available to us. And so that's an ongoing challenge. We've got a great internal team of supply managers, the logistics shop, that materials handling folks that are very good at this, and all the time hunting down new sources of the things that we need, and we feel pretty good about where we're at and where we're headed.
As businesses are reopening, thinking about needing it for their customers, for their employees, are you all finding it a little bit hard to source? Is the supply chain drying up a little bit faster now?
Yeah, some things have had increased demand, certainly. But there are suppliers in the United States who are stepping up to supply more of those kinds of things, particularly things like the medical masks and so forth. And then, of course, a lot of people have been making their own cloth masks. We've done some substituting of cloth masks for medical masks in some situations, not for caregivers, but for folks coming in for services. We relaxed the mask standards for people who don't work in patient-facing positions, so clerical folks. They're allowed to wear custom-made cloth masks if they like, rather than the actual medical masks. And that's all so that we can help conserve the medical mask supply for the direct frontline caregivers. But yes, and with the fall coming, and I think there's going to be a new source of demand on those supplies with schools and so forth. They may not be able to fulfill all their needs with handmade cloth masks or other sources of masking. So I think we are going to get into a period where there'll be increased demand. The question is, will the supply chains be able to ramp up to keep up with that? That was a problem early on. They have improved, but I hope that the national authorities will maintain a focus on that so that going into the fall they'll continue to be plentiful.
Dr. Jetmore, talk about from the public health standpoint what you all are seeing and where the conversation is right now locally.
Well, I think the the situation here in Wayne County is pretty stable and has been for about at least the past week and more. We've had 163 clinical cases, 96 laboratory confirmed cases, and 6 deaths. On average, we find each day we'll have 3 clinical cases and 3 laboratory confirmed cases. And that number's held steady, so that's very encouraging. Our Optum clinic, the numbers have fallen off there we'd like to have 90 plus people getting tested there so we can keep that site, and the numbers have fallen down to about 40 or 50 a day. And I would hope, I don't know if there's any employers watching, but this would be a great time to get all your employees in and have them tested. And they can be tested for free, and you could probably arrange to have them tested as a group if that would be easier. So don't forget that testing site.
And I noticed on today's news webinar that was sort of a combination of health departments and clinical providers. They mentioned that they're relaxing the standards, that you don't have to have symptoms, that you can just come in and get it, and they're encouraging people to do that. In addition to that, they had been turning away folks who were not residents of the county, or residents of the state, I should say. They've relaxed that now, and what they'll take is what they say now is any resident of the state of Indiana can go there for any reason, and anybody who works in the state, even if they live out of state, are welcome to come as well. So I think this is a great time to go take advantage of that. Those are big
And we've
changes.
got a new testing site, the CVS
pharmacy
on
Chester Boulevard.
on Chester. So people can take advantage of that as well.
Talk about that for a minute, because you all have talked about testing a little bit as we've gone through this. And as I understand it, the test is not administered to you. You kind of administer the test. They talk you through it, and you do the swab yourself. Is that optimal in a medical procedure for that to happen?
Initially when this started, I think all of us, and we're learning as we go, Eric, everybody thought, well, we need to have a deep nasopharyngeal swab, which means going clear to the very back of your nose until you hit back of your nose, which is basically a structure called the nasopharynx, which is a pretty uncomfortable thing. And I think people complained about that at the beginning. Then we began swabbing the front of the nose, which is much more comfortable. And it was shown that this didn't affect the accuracy of the test. So once we were able to locate the front of the nose, which is where
So those people who had the other test way at the back where, I think somebody described it as your dreams being stolen or something.
Yeah.
It was,
Well, it was
they're
a lot.
going, hey, we should have waited.
It was physically and psychologically alarming, I think, to some people to see this swab disappear into their face. But now people can just swab the inside of their nose and give it to the person that's going to be doing the test, and they'll be able to have the results in 3 days. And again, I think they can have this test done for nothing.
And I think it was the CVS test you're talking about. They're going to let people ask
Yeah.
people to acquire the sample themselves. I guess I don't know what's gone into that decision. Hopefully that will prove to be as accurate, but I think it sort of makes sense that an actual professional doing it might be better, but maybe they have information.
Well,
that I don't have access to.
they're going to be. I think the people taking their own tests, they'll be coached through this.
Right.
They won't just be handed a swab, and many of these studies show there's a tremendous concentration of the virus in the nose and then in the anterior nose, so they should get a good specimen. And I think this will encourage more people to get tested, which is,
Right.
I think, the other side of it.
Do we need more encouragement? How can we? I mean, the COVID site that we just brought up, that's at the Older Bierman building, has been open for a few weeks now. You're saying the numbers dropped just a week ago. We had just kind of reached that 90-person or so a day mark. Now you're saying we're back down in that 45 or 50 range. And I was looking at the state site today. It still shows that the county still only has 2,500, maybe 2,800 people tested, which is still, even for our county, a relatively low percentage. So,
You know, what's so frustrating about this, and Tom and I have talked about this before, this is sort of like somebody invented a disease to make us crazy as physicians, because you can have COVID, have no symptoms whatsoever, and you're going around infecting people. So that's one of the main reasons to get tested. I'm sure most people think, well, why should I get tested? I feel great. But the number of asymptomatic carriers has been reported from 20 to 50%. And when the state came through and did that first cohort of 5,000 people, they found that 45% of the people that they brought in and tested, these were people that were just summoned to be tested, 45% of those people had COVID and were clueless that they had that. Now, obviously, if you have it, you're doing this for the people around you. The average person with COVID infects 3 other people. They affect 3 others, and you can see how that mushrooms out. So it would allow these people to self-isolate and nip off that area of spread. I don't think you can have too much testing.
Yeah, I think testing has never been easier than it is right now. There are other places in town you can go and even get the antibody test along with the PCR test. I know the urgent care on the east side of town will do that. And you can go to the Optum site. You can soon, I think, I'm not sure when they'll start, but soon anyway, go to CVS. At Reed, we are looking at ways to make the nasal swab and the antibody test more available to people without a prescription from a doctor, without an order from a doctor. That plan is not entirely set up yet, so I don't want to talk about exact specifics that I don't know the details of. But that's something that we want to make available to the public as well. And I think that to me, the best thing is the combination of the PCR test with the antibody testing. You know, the PCR test will tell you whether you're shedding virus right now, but that goes away, and then the antibody test should theoretically tell you if you've been exposed in the past. Now, the thing I always like to tell people is that they've got to maybe consult with a professional about what it means. You know, what does a positive or negative test on either one of those mean for me? Because they will have different meanings. And unfortunately, what we don't know for sure right now is if you have the illness once, are you immune from getting it again? We think that's probably the case, but there really hasn't been enough study on that to know for sure. And in particular, we don't know for sure what the meaning of having positive antibodies is, although it has become somewhat clarified that the antibody tests that are currently available regionally don't seem to cross-react with other coronaviruses, and that was a concern in the beginning, that, you know, maybe I could have had a cold related to one of the non-COVID coronaviruses, and might that make me test positive for antibodies? But that turns out not to be happening, apparently, which is very good, so that if you do test positive for antibodies to the coronavirus now, then that means you had exposure in the past at some point. But what we don't know for sure yet is whether that means you're immune. That's kind of the big thing people really want to know. So I think that the best course of action is get the test, do that, but utilize your own healthcare professional to sort of reason through what that means for you, whether it's positive or negative.
Reminder, if you want to use the site at the Older Beerman Building, they do ask that you register. You can do a walk-in. They would prefer that you do a register, LHICare/COVID testing, and it's very easy to walk through that and get yourself in and out. It's actually pretty simple, pretty painless, some nice people up in there. This is Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, and also available on CTV3 in Connorsville. We do have a couple of questions we got one or two during the week and trying to clear up from last week, so if we can bring the first one up. As preschool children return to schools, if someone in the home is sick, should the child be kept home to help prevent unintentional spread in COVID? Preschool children tend not to cover coughs and sneezes and traditionally spread colds and strep throat. Somebody's been around kids a long time. And such easily among classroom. Preschool is not required, so wondering if preschool is a safe risk at this time.
Well, the question is, if somebody's sick at home, should the child be sent to school? I think one of the easiest ways to resolve that is to test the child. And the child can easily be tested to see if they have COVID. I'm assuming somebody sick at home means somebody has COVID at home. That person should be isolated from the rest of the family with separate bedroom, sleeping area, eating area, and bathroom. The rest of the question, I think, dealt with preschool. All of this is a risk, and it's a calculated risk. In the fall, we want to send our children to school. It's a detriment to society to have children that aren't in school, that aren't learning. So we have to weigh this against the risk of these children contacting COVID. The main people that are at risk in this equation are the teachers. Children tend to do very well that are infected with COVID. There is a syndrome where there's a immunologic storm that's very dangerous to children, but even that has minimum a death rate. So the main people that I worry about in this equation are the teachers. So if I were a parent of a preschool child and the school was doing everything they could, and that means masks, social distancing, washing hands, then I would feel comfortable sending that child to school. The child will benefit. But as I alluded to before, as a parent, you have to weigh one risk against the other. One parent may feel, well, preschool is not that important, I'll keep my child home. Another may feel that's an important learning and socializing process. I think it's worth that risk and send the child to school. I don't know if I answered all the portions of that question. You remember the whole question, Eric?
I think you got most of it,
All
and,
right.
and one of the things that I do want to mention is that we hope to have George Philhauer, who is superintendent of Western Wayne Schools, with us on next week's program. We know we're getting closer to the start of the beginning of school. We know that there are questions being asked about what things are going to look like, or at least try to find out what the superintendents are thinking about and talking about. So we've reached out to one of them. We'll have him in with us as part of next week's Ask the Doctors also. And see if you want to weigh in on the school sending kids
Yeah,
and
It's a conundrum, I think I share all the concerns that Dr. Jetmore articulated, and I think, could kind of see the family side of it too. I want my child to be learning, and I'm sure there are a lot of families where they kind of need their kids to be doing something because they've got to go to work themselves, and so this has ripple effects to just willy-nilly say your child shouldn't go. I would say, number one, every preschool, every school, every activity, Boys and Girls Club and so forth, they're going to have protocols and standards about when child can come in and when not. And so, first and foremost, you follow those. But I like Dr. Jetmore's suggestion of if in any doubt with a situation like the one articulated, somebody at home is sick, have the child tested. That's super easy to do. The child may not like it very much, but there are worse things, and I would do that. Test the child.
Okay. Another question that we had come in. What should we expect from workers in the restaurants and stores in Wayne County as far as masking? Will that be changing anytime soon?
Well, I think anyone who is dealing with the public should be wearing a mask. And I know, I'm sure the person who asked this question and all of the people watching have had different experiences on going out. But I think when you see somebody that's dealing with you that has a mask, they're telling you, you see that mask and you think, oh, that's right, there's a pandemic going on. And you're thinking that person was thoughtful enough to protect me from any viral particle that might be in their breath. And it makes you want to return the favor, and it also makes you feel like you're in a safer environment. I think many of these people dealing with the public, this has been mandated by the governor. For instance, if you go to get your hair cut or get your hair to see your hairdresser, these workers have been mandated by the governor to wear masks. When at the health department, when people complain that someone isn't wearing a mask, we send someone down to remind them that that's not an option that they have. They're required. So everyone who deals with the public should be wearing a mask. That's not asking a lot. And it's one of the things that we can physically do to mitigate this pandemic.
I pulled the opening stage results. We're into stage 4 now, going to be moving to stage 5, and just kind of taking a peek. And through that, in a number of different instances, even in the governor's, face masks are at least recommended. They're not required in some areas, but they are at least recommended. Is that a recommendation that you see that will continue beyond stage 4 or 5 even into the fall in a number of different areas and places, that's a recommendation until there's a vaccine or we have herd immunity or whatever the case may be, that is going to continue to remain?
I think it will. And it's prudent that it should until there is a vaccine in place, or, as you said, herd immunity, and this disease is beaten down to a level where it's not dangerous anymore in vast amounts. I think this is, as we said earlier in these talks, this is a disease with very little treatment other than supportive treatment, no vaccine, we have no herd immunity, so the only way we have to combat this epidemic is by distancing ourselves and wearing masks. I mean, those are the only tools we have, and we need to avail ourselves of those things.
Want to jump in?
Well, I think that the long-term recommendation to wear a mask, that actually is a part of the original version of the governor's plan, that even after the final stage is run through, they're going to recommend that everybody continue wearing a mask. I think the key will be in how strongly that is enforced or required. Is that a requirement or just a recommendation? And I guess we'll have to see what happens with that. But I can tell you that in today's world, what I constantly and I always recommend to people to do is, don't be afraid to go out and do things, but always pay attention to the practices, the sanitary practices of the places that I go. And that includes the behaviors of staff in those places. And, if I go into a place, any kind of retail operation where the staff have masks, but they don't seem to be taking it seriously, that just says to me that maybe the whole operation is not taking it seriously. And I feel less likely, like I really want to stay there and, shop there or whatever it is. And I think that's probably what we all ought to do. And that's how people who operate the businesses will really kind of get the message that they need to take it seriously. It's not always by mandates of the health department or the state, which you get grudging compliance with. But if it actually has an impact on whether a business gets more business and people feel comfortable, people in my age group and older who are in higher risk groups feel more comfortable being there, and that's the kind of business that they want there, then they should be taking it more seriously. And so I always try to look for that, and I recommend other people do too.
I've heard people say lately they've seen more people in Menards than they ever have in the past, and that's one of the places where you can't walk into without having a mask on.
I think I even wondered, I can go to other places and buy the same kind of, tools and whatnot, and they're not. And you go into the other places like that, and nobody has masks on hardly. But Menards just seems busier than ever.
Yeah. Well,
I wonder if it's partly because people like me, feel more comfortable being there, knowing that they're taking it seriously.
Well, I'm a hardware guy. I mean, I'm always buying a tool or supplies or something, and I always would go to Lowe's, and I do not have stock in Menards, but I feel comfortable when I go in Menards. Everybody's got a mask, and I just feel comfortable being there. I'm more likely to linger to shop because I feel safer.
You're watching Ask the Doctors, and we are taking your questions. You can send us a question on Facebook. You can send us a tweet at WCTV Info. Let's go to the next question up. Are the paper masks any better than homemade masks?
If we mean by paper masks the manufactured medical and surgical masks, yes, they are. But it kind of depends on what you mean by better. They do have greater filtration efficiency than you can achieve with just about any other kind of mask material. The issue with homemade masks is that it all depends on what they're made out of and how they're made. And there are some that are very, very good. I wish I would have brought one of mine in. I've got a whole different variety of them. I've got one that I'm pretty sure is probably the equivalent of a medical mask, but because it seals really well, and I know that the material it's made out of has an electrostatic characteristic, which apparently is very important for helping to trap the submicron sized particles. But not every mask is like that, and there's a huge variety of them. And so the cloth masks definitely add value. They're better than nothing. Some of them come quite close to the medical masks, but as far as the consistency of the filtration efficiency, it's really hard to beat the manufactured medical and surgical face masks. Now, I have seen some that may be lower quality, that leave gaps and so forth. I'm talking about the actual manufacturers, medical masks that leave gaps and such, and I'm not too sure about those.
Well, I've seen people where with their nose, the mask comes
Right.
to their upper lip, which just totally defeats the purpose of the mask. I saw some young man working in a store the other day. He had it underneath his chin with his mouth and nose exposed. I think it was just a decorative. He was wearing a mask, but it was serving no purpose whatsoever.
And I see some other, what I consider to be mistakes that people make with masks, even if they're very good masks, is sometimes people will actually twist the ear loop.
Mm-hmm.
I think that maybe that makes it less likely to move or whatever. But the problem with that is it almost always creates big gaps on the sides. And an issue here is that especially in the tiniest particles that may come out with speaking or singing, this is now a very well-known thing, well characterized, that virus particles can come out with loud speaking or shouting or singing. And they come out on tiny vapor particles. The vapor particle rapidly evaporates, leaving the virions just floating in space. So think of, a shaft of sunlight coming at a window, and you see the dust motes floating around that you didn't notice without the sun being there. They just kind of hang in the air. And that's what these virion particles can do. And the problem with that, with masks that don't seal very well, is that when you breathe, you may get a lot of air movement around that. And the tiniest particles that are floating like dust motes very easily get in that way. So I like a mask that provides something of a seal around the mouth and nose, as well as doesn't move. And so that's what I look for in a mask. And you can defeat some of the efficiency of a medical mask by wearing them incorrectly.
Ask the Doctors, Whitewater Community Television's WGTV Channel 11. We've got another question up, I believe. In regards to recent World Health Organization statements about asymptomatic spread, does the County Health Department actually do contact tracing? And if so, what does that process look like?
Well, yes, we do contact tracing. That's kind of our stock and trade. That's kind of our wheelhouse. When we find someone who tests positive for COVID, or there's a presumptive clinical diagnosis, we find out, we interview this person, find out their family members, who they've been around, where they work. We often will ask where they eat, what drugstore they use, and then we'll contact those people. Now, if it's a casual contact, they pass somebody in a line at the bank, we may not follow up. We may not be as interested in that follow-up as we would somebody that spent a half an hour with that person, talking to them in their car, for instance. So it's not only just the contact, but the duration of the contact to get that infective dose of the viral particles. But yes, this is how, this is kind of the main tool of public health, and this has been done for years, these contact tracings. That's what we do.
Is it still the idea that the state is going to kind of pick this up, that they supposedly were hiring and training people to do this, to kind of take it off the counties?
What happens, as you can imagine, the workload that this gets into, and I think people have talked, on a national level, we're going to need hundreds of thousands of people to just do contact tracing. Because if you think about your average day, if you're not, a hermit or totally sheltered in your home, you encounter people all day long. You went shopping for food. You may have stopped at a takeout restaurant. to take some food home. So you'll often, even in this environment, make contact with many people. And one of the things we can do is we can put two and two together. We can think, okay, this person stopped at this carryout, and so did this other positive case, and I remember this third case that stopped there. So then we would probably maybe want to test that person. And we follow these traces down the line. But I think, in answer to your question, Eric, I think the state is going to step in and help all of the local counties, because this becomes a tremendous workload.
Next question up. Do the 60-plus age group also get asymptomatic cases of this? We are all assuming that we will get a bad case, at least be very sick if we get it.
I think the answer to that is yes. You can get asymptomatic cases as a 60-plus-year-old. Have you heard any different, Tom?
No, you know, I'm 60 plus, and I try to be mindful of that I could be carrying and spreading asymptomatically. You know, I think in every age group there's the spectrum of disease. It's just that in the 60 plus there's a higher likelihood of being at the worst end of the spectrum than there is in the younger age groups. And I think that there are certainly people in the 60-plus age groups who are at the super mild end of the disease, have few or no symptoms, or, you know, but can still spread the disease. I think that's true. I think it's a good question of, you know, are you more likely, as a younger person, more likely to be an asymptomatic spreader than have symptoms, and older persons more likely to have symptoms and less likely to be asymptomatically spreading? I don't think we know enough yet about that. That's something that probably over time, you know, with years of study, looking back, we may figure out that could be the case. But I suspect that could be the case because there are so few severe cases amongst young children. And, you know,
the one thing you
some.
point out with young kids, a lot of times they're not asymptomatic, but they may have a symptom that's so minimal. Maybe they have a headache for a day.
Right.
That they're like an asymptomatic case. They're not aware really that they're sick.
Yeah, absolutely. So there's a lot of things we don't know about this disease yet. You know, we're all doing the best we can with it, but it's clearly the severity issue is more for the older age groups. But I think we can't think in absolutes. We shouldn't take away from this discussion that the severe effects are only an issue for the older age groups. It can happen in younger folks, as rare as it might be in the very youngest stages, but we have had, I think, one death in an under 20-year-old in Indiana, and there probably are some cases of the multi-system inflammatory syndrome in children. The thing here is we got to keep things in proportion and accept that there is complexity about it all. We can't think in black and whites.
One of the things that you've been able to do is keep the community up to date on what Reed Health is looking like, number of cases. I know that for, I think, a couple of weeks at least, we were looking at fewer cases. If we can bring that slide up, we can let Dr. Huth go through that for us.
So you should all be familiar with looking at this now, but just as a reminder, these are each set of bars is 1 week. These are sequential weeks. But these are the average numbers within the week. The tall blue bar is all patients who are in isolation areas at about 5 o'clock each morning. That's the more or less arbitrary point in time that we've chosen to make that measurement. And last week we were down in the I think it's 24 range. 25 range. This week, that's because we had several days where the numbers were very low. Now, the beginning of this week, we actually had kind of an influx between It starts with Saturday, by the way. It goes Saturday or Sunday to Saturday. I mean, that's the week. We started off Sunday, Monday with higher numbers in isolation areas, but as the week has gone on, they've declined somewhat. So it looks like there's a bit of a bump up, but I'm not ready to say that there is really a change in the trajectory here. But even more important than that, because we have policies of moving people out of isolation now that we didn't have a month ago, the more important bars are the smaller ones, the red one and the gray one. The red one is all known positives in the hospital. That's averaging 3 a day. Today it was 5 actually. But and then the lowest bar is the number of patients on a ventilator in the COVID ICU, and that has averaged 1 a day. We actually had, I think, 1 day where there were none, and we had another day where there were 2, but it's averaged to 1 a day now. And so the trends kind of continue to be down, flat or down. I'm not ready to say that we're on an upswing, but I can't tell you what the future is going to bring. We'll just have to all stay tuned and see what that is. We all need to keep doing the things that we know that we can do to prevent infection, and that's the way to keep these numbers improving.
There was talk this week that I think one of the companies, Johnson & Johnson maybe, was going to begin starting some human trials on a vaccine maybe about mid-July or so. Based on what you all know about vaccines and coming to market and that type of thing, if that's the case, are we still about a year out if that's the company? Now, I know that there are companies overseas that are also working on things. What are you all hearing as far as, there was talk that maybe the end of the year, even though they were saying that might be a push, if we go through everything, what in your mind are we looking at?
At least a dozen different vaccines in development around the world. I should say at least a dozen that are in the stage of actually administering human trials. Which is amazing to have ramped up in just a few months. But I think there are a total of over 200 around the world that are in development of one stage or another. And this is an amazing feat, really, to have done in such a short period of time. So, a month ago, I would have been skeptical that we could have something within a year. But you know what? There is so much effort and energy being put into it that maybe it could be. But we have to be realistic about it, too. There has not ever been a vaccine developed against any coronavirus. So it would be, not only the timing, but the fact of having of developing an effective vaccine against this coronavirus would be really something. And I fervently hope that it will be the case. But I think what it means is that we have to sort of hope for the best, root them on, and cheer that that they've made so much progress so far, but also continue with to understand the possibility that we will have to do other things to prevent spread of the disease if that doesn't come along as expected. But I think the one other bright spot about that is the specific one that you mentioned that is actually moving on to, I think it's phase 3 trials where they're going to actually administer it to what they've done phase 1 and phase 2. And this is a little bit of inside baseball and research, but the phase 2 trial that they just completed was administering it to healthy volunteers, a small number of healthy volunteers, just to see what side effects may have come about from it. Then that went pretty well. There were side effects, but nothing severe. Now the next stage is to actually give it to volunteers in more endemic areas to see if it can actually prevent the disease. That will require a lot more people, and it require being done in areas where there is still disease around and people have not actually had the disease already. So there are a lot of ifs in there. But assuming that in a few months they can show that they are actually preventing the disease to some extent, and I would be happy with it being preventable to the extent that the average flu vaccine can, which is not 100%. But we know the flu vaccines have a great impact, and I think this one will too if it performs at that level. But hopefully, you know, if things go really well, maybe this dream of having a vaccine by the end of the year start to come online will be a reality. We'll all have to stay tuned and see. But I think we're going to have to do other things as well and be prepared for some kind of hurdle or roadblock to prevent this vaccine becoming a reality, or any of the ones that are under development within the time frames that we would like.
As you see something like that rolling out from a public health standpoint or from a hospital standpoint, what are some of the problems, issues that you all are thinking about, talking about now to prepare to roll it out to people and get enough people vaccinated that it makes a difference? That's always got to be that's got to be an incredible undertaking.
Yeah, that's
to do
an
that and do
insightful
that
question.
safely.
You know, if you think about this, it's not enough to vaccinate everyone in the United States. We're talking about 7 billion people in the world. We're talking about sites for people to get these injections. We're talking about, and this is after manufacturing the dosages, syringes, needles. Yes, this is a tremendous undertaking, and all of this infrastructure will have to be put in place before we can vaccinate all these people. I'm sure other countries will have their own vaccination protocol too. I'm not saying that it's all an undertaking that we have to undergo, but I think about the immensity of it to vaccinate all those people. The men and materiel, it's an astounding feat.
You know, when you talk about vaccinations in general, there has been concern that people are missing vaccines that they should be getting, especially in children. And I know that there's going to be an effort through the health department and through our practices to try to improve, get the vaccination rates back online, at least in this county. But that is a national and a state concern about vaccination rates being lower during the COVID pandemic. But I think it's a little bit interesting that there could be some overlap with other vaccines. I was reading something recently that there's a thought that the measles, mumps, and rubella vaccine, that there seems to be perhaps some association that when people don't get that particular vaccine, that they seem to be a little higher risk of getting COVID. I don't know if that means the MMR can prevent COVID or not, so I'm not here to say that. But I think we have to, maybe it's more about just an attitude about vaccination, that when people have an attitude of, I'm getting vaccinated, that means they're doing more, making other healthier lifestyle choices and so forth, and that the sum of factors may be more preventive for them. But I think I remember Christine saying the other day that we're looking at a grant in the county to actually be prepared for COVID vaccination, as well as doing other vaccines via a mobile delivery system and the like. So do you know much more about that?
Well, I think we're eligible for a $120,000 grant to purchase a van, and if we did get this, we will use this. We can go to the various cities in Wayne County and administer the regular immunization, but we could also use that for COVID vaccine once that COVID vaccine comes online. So these are all encouraging things. I'm encouraged about the progress of these vaccines, because the talk earlier was March or April of 2021. And that timeline, by combining some of these stages of these trials, has really been moved up.
You all learning anything new? You keep saying what we don't know, what we don't know. What can you say for sure about this particular disease, how we fight it, how people go about their summer? Let's face it, the bell is rung on summer. The sun is shining, people are out. So how do you tell people to maintain, be healthy? What can we be doing now to minimize effects? Because it's all about what happened 2 weeks ago may affect what happens 2 weeks from now. You're watching the numbers based on the Memorial Day release, whatever protests, marches, whatever are being held, the kids that are getting together at some of the events that are taking place this summer. And while it sounds like everything's been shut down, there are still some things that are taking place. At what point are you all looking and beginning to go, "Whew, we dodged a bullet," or whatever the case may be?
Well, I think we need to see the numbers not get out of control again. I like to say that we all need to get back to our routine things. We've got to get back to school. We've got to get back to work. We've got to get back to, in my case, providing other healthcare services. But not as though COVID doesn't exist. I think that's the mental mistake that some people make, is that they have to make a choice. It's either everything's about COVID or nothing's about COVID, and we just ignore it. The middle ground is we figure out how to live life more normally than we have been able to over the last few months, but in smart ways that take into account, that assess the risks for exposure to COVID and take steps to minimize those risks. That doesn't mean not doing things. It means doing them smarter, not being afraid, not being fearful, but being smart about things.
When you go skiing, Eric, most of the injuries are toward the end of the day because people let their guard down.
I wouldn't know anything about that.
Take my word for this, Eric. They let their guard down and they get injured. People are climbing a mountain. They get, they get over the most treacherous, most difficult part of the traverse, and then they let their guard down and they get injured. And I think the message I have here is I think a lot of us feel like, well, we got through this, and I don't want people to let their guard down, the people of Wayne County. I look about the world, and there's a lot of cautionary tales. Remember, we were talking, Tom and I both were, about what a wonderful job South Korea had done, and Singapore. And now the infection rates are rising in these countries. We were amazed a few weeks ago that there hadn't been much infection in India. Mm-hmm. And now the rate of infection is going up in India. So I guess my message is we're not out of the woods, and we shouldn't let our guard down. We need to continue to treat this. This is an enemy we can't see. It's invisible. We feel good. It's summer, so it's natural that we want to say, well, that was just a bad dream, and to shake it off. But we need to continue to be vigilant, maintain social distancing, wear masks in crowded areas, especially when you're inside, wash your hands. People are probably sick of hearing me say these things, but I repeat them because they're so important.
As someone who came to public health, really, within this year, what have you learned about what public health can or needs to do better in its conversations with people in pressing community health as a whole?
It's interesting you say that you commented on the short period. I spent my life as a head and neck surgeon. I never thought about public health. I never thought about preventing disease. I spent my life treating the disease that had already occurred. The interesting thing, Eric, about public health is if you are really good at it, no one knows you did anything. In other words, you go into Richmond and you drink some water. You don't come home and say, you know what, to your wife, I didn't get cholera or typhoid. I need to call the health department and give them an attaboy. Or you eat at a restaurant and you don't get food poisoning. So you're not amazed by that. The public health has done such a good job that you just assume these things. You assume you won't get food poisoning. You assume you won't get typhoid or cholera. You assume you won't get lead poisoning. And I think that's one of the things that happens in a pandemic. If you're really good, you hold down the infection rate, And people began to say, well, what was the big deal? We didn't have a lot of infections. There were only 6 people that died, but that was because of what we did. So I think I'm amazed, having been in public health this short period of time, of how much it silently improves the quality of people's lives in terms of their health and well-being. It's a very important part of society.
Dr. David Jetmore, Wayne County Health Officer, Dr. Thomas Huth, Vice President, Medical Affairs at Reed Health, also guest expert on the 5 p.m. news on WHIO on Wednesday evenings. Thank you very much for being here. As always, we appreciate your time. We'll see you next week. I think we're trying to line up another doctor to be part of the program early next week.
Yes, we are.
And we will, once again, hopefully have George Philhauer, who is superintendent of Western Wayne Schools, with us to begin to answer some of the questions as to what the schools are looking at, what the superintendents are thinking about as they're beginning to put plans into place from the recommendations that were made from the state. Thank you very much for being here, gentlemen. Want to remind you of a few things. One, want to remind you of the COVID-19 testing site, that if you are interested in getting tested, you can. The former Elder Bierman building, they do take walk-ins, but you can register, LHICare/COVID testing. If you need some help, the Wayne County Health Department is there to help you. 973-9245 is that number. Be Well Indiana, this has been a very, very stressful time for people. BeWellIndiana.com is a place where you can go and get some help. They're there definitely to help you. Managing mental health is an essential part of well-being in our communities. One of the things that we have always known is that food is also essential, and some of our schools have always taken a hand in that feeding of the community, and you can do it in a number of ways. Centerville Abington Schools has Bulldogs Helping Bulldogs, a Wednesday food distribution from 5 to 6 at Centerville Christian Church. Richmond Community Schools continues their grab-and-go meals, daily drive-through, 8:30 to 9:30, meals on the bus, 8:30 to 9:30, the RCS food truck in Glen Miller Park, also in Clear Creek Park. We mentioned Western Wayne Schools, breakfast and lunch meals will continue to be available for all students K through 12 every Wednesday through the summer, pick up between 12 and 1, and then 5:30 and 6:30. Getting out and about, something both doctors have encouraged you to do, and there are some things that are taking place. Cambridge City's 2020 Spring Antique Fair taking place in downtown Cambridge City. That has been rescheduled for tomorrow between 9 and 4. I'm sure the health department has gone over and made sure the vendors are 6 feet apart and everything like that is going on. And the Richmond Walking Club is back, something being sponsored by the Richmond Parks Department and Reed Health Community Benefits. It starts 7 p.m. on Thursdays at Glen Miller Golf Course. Also want to remind you about our In Focus program this week. We're talking about public health. Our main guest is Christine Stinson, who is the executive director of the Wayne County Health Department. She is our guest on this week's In Focus. You can see that tonight. Thank you very much for watching this week's Ask the Doctors. We'll be back next Friday at 2 p.m. on WGTV, Channel 11. Thank you for watching. Have a good weekend. I wish you well.